Joining us right now is Dr. Sonu Ahluwalia. We have much to talk to him about. You're all reacting to his haircut and
his nice jacket.
And he shaved his beard.
His coat of many colors.
And I love the new set. This is really nice.
There we go.
We did this for you.
Thank you.
All right, let's begin with this. There's a rise in measles and whooping cough being blamed on more people choosing not to vaccinate, even though the message is out there to vaccinate.
Yeah.
Still.
So this is interesting. In 2000, we almost got rid of measles. There were very few cases in the United States. Whooping cough, 1997, very few cases. It's all had a resurgence. Now there are multiple cases of these diseases that are being seen, and we can point to people who don't vaccinate their children as one of the leading causes of this to happen.
We're having a big problem with whooping cough right here in California.
Yep, and same thing with measles. We had all those outbreaks that we talked about. And you know, I've mentioned this before, the concept of herd immunity. Herd immunity means that a certain number of people in the population need to have the immunity to prevent the virus from passing from one person to the other. So if that immunity doesn't exist, and it has to be somewhere around the 90s, once it dips below that, it fosters this ability of the disease.
Is it still true that the people who tend to shy away are people who have more access to doctors and are wealthier rather than the other way around?
Of it all,
exactly.
Isn't it?
So all over the world, the reason that people don't get vaccines is either because they can't afford them or they're unavailable. In our country, all the vaccines are covered under the Affordable Care Act. We still don't get them.
What would you say to parents who are still choosing not to vaccinate?
So look at the reasons why you decide not to do that. There is no link between vaccines and autism. That has been debunked.
But
clearly.
Time after time after you say that, people for whatever reason are not processing this information.
So the person that everybody quotes is this gentleman by the name of Andrew Wakefield, who has been noted to be a fraudulent researcher by the British Medical Journal, has been kicked out of the society and is no longer accepted. His research is no longer accepted. But people like Jenny McCarthy and all these other celebrities quote him and give credence to his research where we don't believe it anymore.
She has even pulled way back.
Yeah, but it's like people believe it. You know, we still have people that,
you know why? Because it has to do with our little babies. So
agreed. You know, autism presents itself at a time when you get the vaccines.
Getting vaccines.
So it is, you know, we want a reason.
And there is no cure or understanding of it. It's still such a mysterious thing that you're looking for something to say that's why this is why it happened.
Here's the interesting thing. The measles and the whooping cough are not harmless. When your children get these diseases, there is a high incidence of, you know, inner ear problems, pneumonias, and infants don't have immunity. That's why when we have little babies, we get immunized.
All right, on to the other subject, and it has to do with new guidelines from the CDC about doctors and pain medication. We have been living in a couple of decades here where pain medication has become the way to go. It still is to some extent, is it not?
So when I was training in the late 90s, early 2000s, we were told we weren't taking care of pain well enough.
Right.
That we were too stingy with our pain medicines.
Really?
Yeah. But I think that the pendulum has now shifted the other side. So now we are over-prescribing. The number of deaths from opioid overuse has gone up. And not only that, opioids are the highest prescribed medicines in the United States.
Name a couple of opioids.
So addictive.
Oxycontin, Vicodin, Percocet, these are all opioids, and they're all...
So if you have any sort of minor surgery or anything, that's normally what you're going to
receive.
And,
but, you know, here's what's happened. So we can no longer call in these medications, right? So that was the sort of the way to restrict it. But what has happened is it's pushed people to go into heroin and other medicines that are illicit because they no longer get them from us.
There are still doctors and dentists who are script writers.
Yeah.
And people find them and go to them.
Yeah.
And the word gets around and everyone in town ends up going there.
I have a question here for you. People who suffer from chronic pain, you can't assess how bad their lives are. They're the only ones feeling it. So some people say addiction sometimes might even be better than the chronic pain they're in.
So these guidelines don't apply to people who take care of chronic pain patients. These are for internists. These are for people who are just giving these pain medicines because either they don't want to be called about this again, or because it's just easier to give a patient a prescription so they don't have to come back to get another one.
So when you go into a doctor's office, what's the process like? You ask a bunch of questions and then you determine whether or not you're going to prescribe. So someone could be convincing you, essentially.
Right.
and maybe not being completely honest about what they're going through,
right.
that leads you to prescribe the prescription.
It takes a lot more time to convince somebody to do non-prescription medications, right? To try acupuncture, to try physical therapy, to do things that don't involve pain medicines, right? We're running, we're constantly trying to get as many people as we can see to make them better.
If you're in pain and someone tells you to go to acupuncture, you're
okay, but not only that, we were just talking backstage. People have the expectation that you will never have pain of any sort. It is impossible to make you zero pain, right? If you have a chronic disease, you may have a 1 or a 2 or a 3, and you may have to decide to live.
And I would tell you, I know we got to wrap up. I have fortunately been blessed with good health. The only time I've had an episode in the last
That was not my fault.
decade, which it was right after you came here.
That was not my fault.
Was because I was taking a particular product for after like working out, etc. One of the NSAIDs, and it caused internal bleeding, which led to anemia. It was all caused by taking the product.
Now that was over the counter, though, right?
Over the counter, just simple. Oh yeah, absolutely. Yeah,
harmless.
Absolutely.
Says it all right there.
Yes, yes.
No medicine is harmless.
Yes.
There
if you're putting something into your body to fix something, it's going to affect something else.
And
that's
so,
just common
when you
sense.
say, hey, you know what? You just worked out, your little sore papa, papa whatever. No.
Then you end up in the hospital.
That's the good sore.
Watching us on TV, wondering what happened.
What happened to your life?
I'm gone for a couple days.
Laughing and sitting on somebody's lap, and I'm sitting there about to get balloons
go
go up my internal organs. But that's another story.
Let's not revisit
And he doesn't blame me to this day still.
Yeah,
I wasn't involved in that one.
Move over there. Sonu, thank you very much. Dr. Ahluwalia.
Thank you, Dr. A.